Welcome to the deep dive, everyone. Today, we're going to kind of unpack some research and data about something pretty crucial. It's India's healthcare workforce. And, over the past 30 years, there have been some, really major shifts. We're talking massive growth, but also some pretty tough challenges. So get this. India now has over 700 medical colleges. But as you might imagine, it's not quite as simple as more colleges, better healthcare, right?
Right, yeah. India's journey in building its healthcare system is fascinating. I mean, there's tremendous progress, but also, these ongoing complexities that they've had to deal with. To really appreciate the scale of it all, you have to consider this. Back in the 1990s, there were only a handful of medical colleges. And now, besides the 700-plus medical colleges, they also have thousands of institutions that are training paramedics and nurses.
Wow, those numbers are pretty mind-blowing. It sounds like a really huge investment in their healthcare system. But you mentioned complexities. What are we talking about here?
Well, one of the biggest challenges is just the uneven distribution of healthcare professionals. It's a classic case of the urban-rural divide. The major cities have a high concentration of doctors and hospitals, and then that leaves the rural areas really underserved.
Yeah, I could see how that would create a real problem with access to quality care. It makes me think about all the situations where people in those remote areas have to travel long distances just to see a doctor. And that can be a huge barrier, especially in emergencies.
Exactly. And it's definitely something the Indian government is actively trying to address. They've launched, initiatives like the National Rural Health Mission, and that focuses on improving healthcare infrastructure in those rural areas and just making services more accessible.
So they're building more hospitals and clinics in rural areas. That seems like a logical step.
It is, but it's not just about, bricks and mortar. They're also increasing funding for nursing education, which has led to, a significant increase in the number of qualified nurses.
That's interesting. So it sounds like they've taken kind of a multifaceted approach. They're tackling both the infrastructure and the human resources. But are there even enough doctors to staff all these new facilities?
Well, that's where another major challenge comes in. That's brain drain. A lot of these highly skilled Indian doctors and nurses are drawn to opportunities abroad, particularly in developed countries.
Yeah, it makes you wonder what's driving that talent exodus. Is it just about higher salaries, or is there more to it?
I mean, salaries are definitely a factor, but it's more than that. A lot of Indian doctors are attracted to countries like the US and the UK, where they, find better research opportunities, there's more advanced medical technology, and sometimes it's even a perceived better quality of life that they're looking for.
So it's a combination of professional and personal factors. Seems like a tough problem to solve. What strategies is India using to try and keep their skilled professionals from leaving?
Well, they're working on several fronts. For starters, they're trying to make staying in India more appealing by improving salaries and just the working conditions in general for healthcare professionals.
It seems like a good starting point. But what about the other factors, like opportunities for growth and development? Are they addressing those as well?
Yeah, that's another area of focus for them. They're working on creating more opportunities for career advancement within the Indian healthcare system, so doctors and nurses don't feel like they have to go abroad to reach their full potential.
It sounds like they're really trying to create a more supportive and rewarding environment for healthcare professionals.
They are, and there's another interesting idea that they're exploring. It's developing medical infrastructure in what are called Tier 2 and 3 cities. These are smaller urban centers, but they have significant growth potential.
I'm not familiar with that term. What exactly are Tier 2 and 3 cities?
Essentially, they're cities that are smaller than the major metropolitan areas like Mumbai or Delhi, but are experiencing rapid growth and development. Think of them as up-and-coming cities with a lot of potential.
Okay, that makes sense. So how does focusing on these cities help with the brain drain issue?
Well, the idea is that by developing, high-quality medical facilities in these Tier 2 and 3 cities, you create attractive job opportunities outside of the major urban centers. This could encourage doctors and nurses to stay in India, but maybe, relocate to a smaller city instead of going abroad.
That's a really interesting approach. So instead of trying to compete directly with the allure of developed countries, they're trying to create these compelling alternatives within India itself.
Exactly. It's about recognizing the needs and aspirations of these healthcare professionals and then, finding creative ways to meet those needs within India's own healthcare system. And while we're talking about the healthcare workforce...
You're about to remind me that it's not just doctors and nurses, right?
Yeah, it is. Yeah. It's crucial to remember that entire ecosystem. We often focus on doctors and nurses, but lab technicians, radiologists, paramedics... These unsung heroes are absolutely vital, too.
Absolutely. And I imagine their role became even more critical during emergencies like the recent pandemic, right?
You're absolutely right. They were often on the front lines working under some incredibly challenging conditions. The pandemic really highlighted just how important it is to have a strong and well-trained workforce at all levels.
It's a good reminder that a healthy healthcare system really relies on so many different people, each playing a crucial role. So what about their training and development? Is India investing in that area as well?
Absolutely. Investing in training and professional development for all healthcare workers, from paramedics to specialists, is recognized as, essential for the overall improvement of India's healthcare system.
Yeah, it makes you wonder what that kind of investment looks like in practice. What are some of the concrete ways they're improving training and development for all these, different healthcare roles?
Well, it's really a multi-pronged approach. There are initiatives to standardize training curricula and also introduce more hands-on learning experiences. And they're really trying to leverage technology, for more accessible training programs, especially for those healthcare workers in those remote areas that we were talking about.
So they're thinking about both the quality of the training and just how to actually deliver it effectively. That makes sense. But all this talk about, attracting talent and training and, working conditions, it makes me think about something we haven't touched on yet, and that's the well-being of these healthcare professionals.
Yeah.
I mean, it must be incredibly demanding, both, physically and emotionally.
You're right.
Yeah.
It is. And unfortunately, the mental health and well-being of healthcare workers is often overlooked. It's a very demanding profession with long hours, high stress, and often, very limited resources.
Yeah, it's almost like we expect them to be superhuman,
Yeah.
always putting the needs of their patients first without really considering their own well-being.
That's a good point. It's really crucial to remember that healthcare workers are human too. They have their own limits and vulnerabilities, and neglecting their well-being, it not only affects them personally, but it also impacts the quality of care that they can provide.
That's a sobering thought. I mean, a burnt-out doctor or nurse is simply not going to be as effective as one who feels supported and cared for. So what can be done to address this? How do we better support our healthcare heroes?
Well, it requires a multifaceted approach. For starters, hospitals need to implement, better mental health support systems. This could include offering counseling services, stress management programs, peer support groups, and just resources that are specifically tailored to the unique challenges that these healthcare workers face.
Yeah, just having those resources readily available could make a huge difference in helping them cope with all those pressures of the job. But what about preventing burnout in the first place? I mean, are there things that can be done at a more systemic level?
Absolutely. One crucial step is implementing mandatory rest periods. Healthcare professionals often work incredibly long shifts, and it's just not sustainable to expect them to work nonstop without breaks. They need time to recharge, both physically and mentally, so they can, provide the best possible care.
That makes a lot of sense. I mean,
Yeah.
even in, less demanding jobs, we all know how important it is to take breaks and just kind of step away from work to clear our heads. But it's not just about taking breaks, during a shift, is it? It's about, overall work-life balance, right?
You're absolutely right. Healthcare workers need time for their families, their hobbies, their own personal lives. That balance is crucial for their well-being. And ultimately, it impacts, their ability to perform their jobs effectively.
So it's about creating a culture where it's okay to prioritize your own health and well-being, even if you're in a profession that's, all about caring for others. It almost seems counterintuitive, but it ultimately benefits everyone.
Exactly. It's about recognizing that healthcare workers are heroes, but they're also human. Their well-being matters not only for their own sake, but for the sake of the entire healthcare system.
Wow. It's amazing how much we've uncovered about India's healthcare workforce just in this, short amount of time.
Yeah.
I mean, we started with this incredible growth story, hundreds of new medical colleges, thousands of institutions, training, all these other healthcare professionals. But then we, had to dive into those complexity, those challenges of distribution and brain drain and, that often overlooked issue of just healthcare worker well-being. It's a lot to think about.
It is, and it really highlights that, building a strong and equitable healthcare system is a process. It's ongoing. It requires, careful planning and strategic investment and a real commitment to addressing the needs of both the patients and the healthcare providers.
So, for our listener who's been with us on this whole deep dive, what are the key takeaways? What should they really remember about this complex issue?
I think, the biggest takeaway is that India's healthcare workforce has come a long way. I mean, the sheer scale of the growth is really impressive, and it shows a real commitment to improving, healthcare access for this vast population. But it's also important to remember that progress, it doesn't happen overnight.
Right. And those challenges that we talked about, those aren't unique to India, right?
Yeah.
I mean, I'm guessing a lot of countries face kind of similar issues with distribution and retention and the well-being of their healthcare workforce.
You're absolutely right. These are, global challenges. And the lessons learned in one context can often be applied to others. For example, the strategies that India is using to combat brain drain, things like improving salaries, creating better working conditions, focusing on professional development. Those are all things that, could be implemented in other countries as well.
Yeah, it makes you realize that healthcare is really, a global issue.
Yeah.
We all kind of connected in a way. And the solutions we find in one part of the world could have, a ripple effect elsewhere.
Exactly. And, it's not just about governments and policymakers finding those solutions. We all have a role to play, in advocating for a stronger and more equitable healthcare system.
That's a great point.
Yeah.
So beyond, just understanding these issues, what can our listener actually do? Are there concrete steps they can take to make a difference?
Absolutely. There are a lot of ways to get involved, even at a local level. You could volunteer at a local clinic or hospital. You could donate to healthcare charities or, even just educate yourself about the challenges facing healthcare workers, right in your own community.
Those are all great suggestions.
Mm.
And, sometimes even just having those conversations with friends and family about these issues can raise awareness and, kind of spark a desire to get involved.
That's right. Even small actions can contribute to a larger movement for change. It's about recognizing that, a strong healthcare system benefits everyone and that supporting healthcare workers is just a crucial part of that.
Well said. So as we kind of wrap up this deep dive, I want to leave our listener with one final thought.
Right.
We've talked a lot about those challenges facing India's healthcare workforce, but there's also this sense of hope. There's innovation and a determination to find solutions. It's a complex issue, but it's not insurmountable. And just by understanding these complexities, we can all play a part in kind of shaping a healthier future for everyone.
I couldn't agree more. It's a journey, and it's a journey we're all on together.
Well, thank you so much for joining us on this deep dive. We hope it sparked your curiosity and given you a new perspective on the world of healthcare. Until next time, keep learning, keep exploring, and keep asking those questions.